Have you ever looked at an MRI report for multiple sclerosis and felt a bit overwhelmed by the terms used? It can be challenging to understand what all those words really mean for your health and for your future. One common phrase you might encounter describes inactive lesions. Inactive multiple sclerosis lesions on an MRI scan are essentially old scars on the brain or spinal cord. These are areas where inflammation caused by MS has occurred in the past, but it is no longer active at the time of the scan. Think of them as historical markers of disease activity, showing where your immune system once attacked the myelin sheath, but has since quieted down. They do not enhance with gadolinium, a special dye used during MRI scans, which is the key indicator of their inactive status. The reason these lesions are called inactive is primarily due to the absence of active inflammation. When MS is active, immune cells break down the myelin, causing swelling and damage. During an MRI with contrast, an intravenous injection of a special dye called gadolinium is given. This dye leaks into areas where the blood-brain barrier is compromised due to active inflammation, making active lesions enhance or light up brightly on the scan. Inactive lesions, however, show no such enhancement because the blood-brain barrier has largely healed in that area, and the acute inflammatory process has stopped. While inactive, these lesions representing permanent damage or demyelination, meaning the protective covering around nerve fibers is gone or severely damaged. This damage can still lead to symptoms or disability, even if the inflammation itself is no longer ongoing. They are often referred to as T2 lesions because they appear bright on T2 weighted MRI sequences, regardless of their activity. Understanding the difference between active and inactive lesions helps your neurologist assess your disease course. When your MRI shows only inactive lesions, it can be a positive sign, indicating that your current treatment might be effectively preventing new inflammation. However, it is important to remember that the presence of inactive lesions still means that damage has occurred, and these areas can contribute to your overall MS symptoms or disability. A fascinating aspect of MS imaging is the concept of black holes or T1 hypointense lesions. These are a subset of inactive lesions that appear very dark on a T1 weighted MRI sequence. A black hole often signifies severe and irreversible tissue destruction within the lesion, indicating significant nerve fiber loss. While not all inactive lesions become black holes, their presence can suggest a greater degree of axonal damage and can correlate with increased neurological disability over time. Knowing about inactive lesions and their implications allows you to have more informed discussions with your healthcare team. It highlights the importance of regular MRI monitoring, even when you feel stable, to track both new active inflammation and the accumulation of these permanent changes. This knowledge empowers you to understand your MS journey better, reinforcing the ongoing need for effective disease-modifying therapies to minimize both new damage and the long-term impact of old lesions.